Hi guys, my name is Danny, and for my project I decided to do types of fractures. So first I'm going to start off by defining what a fracture is. So a fracture is a break in bone or cartilage. They're usually from a trauma. They can happen in sports or car accidents or really like anything, but they can also be from congenital bone diseases that just cause the bones to break frequently. And then lastly, they are classified by like their location and then the type of fracture it is. There are 6 main types of fractures. There's communicated, compression, spiral, epiphyseal, and depressed and green sticks. So in this video, I'll be talking about the different kinds, and yeah, let's get going. So green stick fractures are incomplete breaks in young flexible bones. This means only one of the bones will break and the other bone will bend but not snap. They are called green stick breaks because they occur in young bones which are flexible and can be compared to young green trees. Treatments may require surgery but usually are able to go into a cast and have pressure applied until the bones are where they should be, and then they can heal properly on their own.
Strolling along. Oh, look, a doggy. Ow! Might be a green stick fracture.
A compression fracture is a break in your vertebrae. It occurs when one or more of the vertebrae in your spine weaken and crumble. A compression fracture is typically caused by a loss of bone mass that occurs as part of aging. A cough, fall, or lifting of a heavy object may cause a fracture of the backbones. Treatments may include physical therapy and medication, or in extreme cases, surgery is required.
Been ready. Oh no! My back. It might possibly be a compression fracture.
A communicated fracture is when a bone breaks into 3 or more pieces. This typically happens in aged or brittle bones. This type of fracture requires a high impact accident to occur, so it happens often in a car accident or when someone falls a significant distance. Surgery is usually required for these types of breaks, and doctors often prescribe anti-inflammatory drugs to help reduce swelling and pain. In some cases, the doctor may need to perform a reduction, which is the process of resetting the bones.
Oh, it's broken in like 6 places, maybe more. It's gotta be like a communicated fracture.
A spiral fracture is a type of complete fracture. It is the most common type of sports fracture. It is caused by rotational or twisting force which causes the bones to snap. Spiral fractures only need surgery if the bones are displaced from the break. If they are not displaced, then the patient can wear a cast for around 6 weeks or until the break is completely healed by itself.
Oh my god! I think it's a spiral fracture.
These breaks occur in the epiphyseal plate, which is also known as the growth plate. They can occur from a fall or heavy amounts of stress on the bones, which causes it to break. It causes your cartilage cells to die, which can stunt your bone growth in the affected area. Epiphyseal breaks require surgery because even the slightest offset of the bone can cause bone defects. It causes one limb to be shorter than the other due to its lack of healing from the break. These breaks are commonly treated with screws across the epiphysis.
My epiphyseal plate.
The last type of fracture is a depressed fracture, which is when your skull bones are pressed inwards toward your brain. They are typically caused by a blunt force trauma to the head. They occur in 11% of all head injuries. People get depressed skull fractures and assume that they are fine. Doctors often call these patients talk and die patients because they think they're fine, but they actually have caused a blood clot to form without them realizing, which is lethal. Elevation and debridement of the fracture is required in surgery.
It might be a depressed skull fracture. Wait, what'd you say again?
Wow, you suck.